Hello and welcome. Today I am going to be discussing strategies for working with elementary school students that have endured trauma in their past. As Lauren has already discussed trauma, I'm going to cover the basics very quickly. American Psychological Association says that a traumatic event is one that threatens injury, death, or the physical integrity of self or others, and also causes horror, terror, or helplessness at the time that it occurs. Types of traumatic events include maltreatment, witnessing violence, deaths, near-death experiences, sexual abuse, physical abuse, emotional abuse, and much more. According to the CDC, a survey conducted in 25 states found that approximately 61% of adults reported having experienced at least one adverse childhood experience. Close to 1 in 6 adults also reported experiencing 4 or more types of adverse childhood experiences. To put it into perspective in our field in particular, children with disabilities are at least 3.2 times more likely to experience trauma in the form of maltreatment than their peers without disabilities. If you would like to review information on trauma, please visit Lauren's presentation. Before we begin, I would like you to pause and reflect for a moment. As a teacher, how many students a year do you teach that have experienced some form of trauma? Were you able to identify that they were experiencing hardship? If so, how? Do you teach lessons related to social and emotional skills? How do you handle challenging behaviors in your room? What about your paraprofessionals? How do they handle them? And lastly, how does helping a student cope with their trauma make you feel? Does it overwhelm you, stress you out, make you feel inadequate, or do you feel prepared? Remember, there is no right or wrong answer to how you feel. In order to help our students cope with the trauma they are experiencing, we first have to be able to identify that the child is going through trauma. Some signs and symptoms are re-experiencing, avoidance, and hyperarousal. Within those categories, there are signs and symptoms that we can look for. For re-experiencing, a child may be experiencing nightmares or reenacting themes during playtime of events that they've gone through. They may cry, show anger or aggression. They may be self-deprecating, harmful to themselves. They might show hoarding, signs of checking out, or soiling themselves. For avoidance, a child may be withdrawn from people, places, or activities. They may show a lack of positive emotions. They may have changes in interests, pervasive negative emotions, or limited physical proximity. Lastly, they might experience hyperarousal. This includes temper tantrum, hypervigilance, diminished attention or concentration, and a sense of having heightened emotions or being startled. These are symptoms that we should all remember and look out for in our students. If our students are experiencing these, they may be going through a traumatic event. Initially, turning your classroom into a trauma-responsive classroom may seem overwhelming. There are many small classroom changes that can be made that will make a huge impact. For one, expect the unexpected behaviors in your students. Students can have an outburst at the most unexpected times when they are facing trauma. Although it's easy to become impatient and frustrated, be patient with the student, remain calm, and try not to take the outburst personal. Be very thoughtful in your communication. Be cognizant of the language you are using with your students. Students who have faced trauma can become defensive when around adults. How teachers phrase things has a direct impact on student reactions. When possible, avoid commanding directives such as pick that up now. Students will respond better to, can you please go pick that up for me? Next, try to form a relationship with your students. Some students that have faced trauma don't know what a healthy relationship looks like. It is our job to show them an example of what a healthy relationship is. Your relationships with students should be based on respect, trust, and understanding. Lastly, be consistent. Students that have faced trauma often experience anxiety. Providing visual schedules, trying to keep a consistent classroom routine, and making your reactions consistent will help your students feel comfortable, secure, and safe in your classroom. Next, we are going to discuss some easy classroom changes that you can incorporate into your room. 1, make sure that the decorations are welcoming for students. This could mean that they have a bright, positive, colorful, happy effect, or a soft, warm, comforting effect. It doesn't matter as long as the students feel welcomed and safe in your room. Next, consider dimming the lights. As you guys know, oftentimes classrooms have bright and a little harsh lights. Dimmed lights can have a calming effect on a room. Next, calm down corners encourage self-regulation skills and give children a safe place to process their emotions. A child should always feel safe in your room and feel that they can go somewhere to collect their feelings. Next, consider flexible seating. Wobble stools, rocking chairs, yoga balls, anything that has flexible seating is good for kids that need to make movement in order to self-soothe. These changes will really help your students throughout the day. Next is a podcast that gives a crash course in trauma-informed teaching. The video is a little long, but the woman gives fantastic advice on how to make your room trauma-informed and different strategies that you can use. I'm going to pause the video here to allow you time to watch it.